Hey, friends, welcome back to another episode of Dentistry Unmasked. My name is David Rice, and here, as always, with
Hey everybody, Pam Maragliano-Muniz. I'm so excited this week for this episode. Number one, I just love every moment I spend with him, but it's now like official that we work together. Dr. Brian Novy, welcome back to Dentistry Unmasked.
Thank you, Dr. Pamela Maragliano-Muniz and Dr. David Rice. I know it's official. My name is on the door at the office. How exciting is that? That was an exciting moment in my life to see my name on the door. Thank you, Dr. Pam.
Oh my God, please. I'm so excited to have you there. And yeah, no, it was a long time coming. So I'm glad that your name is on the door and it's official and you come over to the office and soda's there and all the things and you bring so much fun energy to the office and it's great. I love having you there.
Well, I love going to this can be a love fest between Dr. Pam and Dr. Brian, but I just think let that be a lesson to the kids out there. Don't skip breakfasts at dental meetings because you may just happen to pull up a chair and sit next to someone who turns into being your lifelong friend, and you're going to join their dental practice. They're going to put your name on the door. And I mean, we're using AI together. Who thought at breakfast years ago, Pam, that you and I would be using Overjet and looking at the diagnostic potential of AI? And I mean, I'm just sorry, but just to jump, I mean, not to just jump right into this, but to be able to look at each other yesterday and go, do you think we can try Papa Carry Duo on this? Yeah, okay, get out the video camera. Oh my gosh, okay. And setting up the whole video system so we could videotape me using Papa Carry Duo for the first time. And then at the end of the procedure, remembering, oh my gosh, we just recorded that whole thing. We just got some really good footage of a guy who squirted gel all over the tooth with no control over what he was doing. And it was like, I wonder what this stuff does. And how fun is that? How fun is it to be a practicing dentist?
Oh my gosh, it's so fun. I know I turned it into a verb. I was like, let's pop a carry duo it. Let's
Let's,
let's
let's Papa
duo
Carry.
it. Yeah. So no, it
it
was
feels like a
super fun.
band, and t-shirts need to be made.
Maybe we should define
Yeah.
our terms. We're not talking about a band, Dr. Rice. We're talking about the new chemical caries removal agent that means you don't have to use a handpiece. You just put this gel in a tooth, it removes the infected dentin, and then you rinse it away with a car wash spray and then restore your tooth. It's crazy. It's
Tell us
crazy.
more.
Well, so what's crazy about it too is that it's like, yes, there's like a chemical aspect to it, but it's made from an enzyme from
Yeah,
a papaya. It's
it's a
not
papaya
like,
enzyme.
yeah, it's not even like this crazy caustic thing
And
that,
it's a great facial, like a microdermabrasion. I mean, I know that the sales reps, it's a really expensive. We probably shouldn't put this on there because if we buy it for the office and our teams hear this, they can use it as like a microdermabrasion facial. And I tried it, and that's why my skin looks so great at Hinman, Pam, was because I used that anyway, it doesn't matter. That's not what we're here to talk about. But it is really cool stuff because Dr. Rice, to answer your question very clearly, because I have a lot of stuff that I want to talk about. I have
Yeah.
1, 2, 3, 4, 5, 6, 7 things that are new to carryology that I want to talk about. And we're already talking about Papa Carry Duo. So let's just pop into it.
let's just pop
Very-
into it. But I do have to say, I have a friend that's a pediatric dentist that put Aquasil on her nose to remove her blackheads. She was like, I'm a pediatric dentist. What am I going to use impression material for? So it's interesting that we have other uses for our dental material. So, okay, I digress. So
That
we're
reminds
talking,
me of the nose waxing kits. Have you tried the nose waxing kits? Those are much better than squirting polyvinyl siloxane up your nose to wax your nostrils. But that's not what we're here to talk about. We're here to talk about caries, medicaments that are new to the profession for 2025, which are quite revolutionary.
quite. Okay, so you've got what, 7 things to talk about, and we have 30 minutes to record, and we've probably used like 5 of it talking about nothing. So let's jump in. What is one of your new things that maybe people haven't heard of?
Okay, so color changing explorers that we can give to patients that they can check their caries lesions themselves. So CaviSense explorers that are they're like color changing paper points. They actually are pH sensing disposable explorers that are actually edible. You could swallow it. I wouldn't swallow the plastic handle, but if you were to eat the little tip of it, it's going to be just fine. And you place it into any pit and fissure you think there's active caries or any interproximal contact where there could be active caries. And if it turns yellow, if that little stick turns yellow, you have an active caries lesion. And it means that you can find things early and put technology in the hands of patients so they can check these things at home. Like imagine that mom who's like, Oh, I'm worried about that spot on my kid's chewing surface of that molar back in the back of their mouth. Well, come to the office, swing by the office and grab one of these things off the front desk in the little pink box and take that home and smash it in there. And if it turns yellow, yeah, you need to get in here and we need to do something about that cavity before it gets any bigger. So that's the CaviSense color changing toothpick that is putting
Wait, so
caries.
what are we going to do about it? Is it something where it turns yellow and you're like, I need to fill it? Or are you like, no, I'm going to turn it yellow and therefore I need to jump in with my fancy preventive measures?
It's jump in with your fancy preventive measures because you're going to be able to find these susceptible pits and fissures long before you ever realize something was going on. So it's really cool. They've done some studies with some sealant collaboratives in some rural communities in the United States, finding that teeth that they would have normally said were sound and those kids didn't need sealants, that when they tried poking these, and it looks like this, when they tried poking this thing into the tooth, it turned yellow and like, no, clearly that kid is a high-risk kid, and they sealed molars that they would have just assumed the kid was low risk. But I think it really speaks to the point of we are identifying caries so much more early now, and we should be doing so much more to prevent it, not just looking at a child saying, are you high risk or low risk? Let's keep them low risk if they're low risk by putting sealants on their teeth. And when you can give, especially like you and I know, Pam, when you're using glass ionomer sealants that are made to dissolve away if they are utilized by the tooth as protection, they'll dissolve away. Then you want to be able to take something like this and stick it in the tooth and go, okay, the sealant I put in there dissolved away. This thing will turn yellow in that environment, showing you why that dissolved away, because the tooth surface is so acidic, it's dissolving your sealants away and it's protecting the tooth. So much different than having the tooth dissolve away from around your plastic resin composite sealant.
So I have a question. Is this a baby litmus test or is it testing for specific bacteria?
It's like a baby litmus test. It's like a micro litmus test. And there's another version coming out soon, which is even more wicked cool than these little toothpicks. And they're so cost effective. I mean, they're pennies on the dollar compared to, I mean, not pennies on the dollar, but for $10, you can buy a number of these devices, which allow you to monitor your kids watching those watchable areas. And I mean, it's a lot better than me as a kid. I was taking explorers that I would steal from Dr. Tanner's bracket table, and I would go home and poke my explorer from tooth to tooth to tooth, trying to get it to go dink, dink, dink. And I thought it was being a dentist. Well, this is what you want to give those little kiddos to ignite them into becoming young dentists in the future. Say, go use this color changing paper explorer. You can't, rather than giving kids sharp explorers, because of course no one gave me a sharp explorer. I stole it, but I returned it. I returned them when I went to work for Dr. Tanner. But we digress. That was just one of the really cool things that have hit the market for caries management in the last year.
And is that like available only through us at a dental practice or direct to consumer?
I think right now it's only available through dentists, but I know on their website, they have a whole section for parents and for patients. So I imagine they sell them little kits that parents can take home with a number of things in it. They sell a gigantic kit for you to have on the front desk of your office. And now that we have CDT codes for these point of care testing things that we're using, like the oral genome test, we haven't even talked about oral genome test. There's a state in this country where can I say insurance companies on here?
Sure.
You can say whatever you want.
Avisus is paying for the oral genome test because we're now identifying patients who are pre-diabetic or diabetic and undiagnosed with the oral genome test. So you just take a sample of your saliva, put it in a couple tubes, hit it with some reagent, take a picture of it with your cell phone, and it can identify you as being pre-diabetic or diabetic. And Avisus is saying, wow, we see the value in salivary diagnostics now, because if patients use this technology, we can route them to care before they have their first diabetic crisis, and you can find it in the saliva. And may I say, this thing was created by one of my students back at Loma Linda. So I'm one proud dental school professor who she went and patented the first point of care salivary test for patients to use at home. And it's all rooted in trying to find high caries risk patients before they start developing caries lesions. So I must have taught her well.
No, I love that. That's amazing. You definitely taught her well. And I'm sure when she's thinking of her mentors and inspiration people, you are certainly on that list. All right. What is next? So far, so good.
Can we talk about patients who like cannabis and what we
Yeah.
do for those patients who have dry mouth? Because Pam, you and I both know that uh, there are patients sometimes in Massachusetts who leave vapor trails behind them.
Mm.
And I don't mean, and by vapor trail, I mean the smell of the devil's lettuce, or what do we call it in Salem? I don't know what the kids these days call it, but the cannabis connoisseurs, the ones who are come in showing us pictures of their marijuana trees that have trunks the size of like my thigh, and they're talking about how much their harvest is these days. Why is it that you cannot get them fired up about using a topical cream that remineralizes caries lesions, but the moment they find out that there's a CBD toothpaste that you have that that is in your office, that's one that you have, they're like, that's the one I need. No matter what the price is, I need that CBD toothpaste. So how much time do we have to talk about? We're finally getting evidence, and the evidence is now mounting for the therapeutic benefits of CBD. Can we talk about that? Or we not, or we not talk
Absolutely.
about that?
Yes.
No,
Oh,
we
let's
need
do
to.
it.
It's new, and I think that people need to hear about it because I think people hear CBD and they think they're going to brush their teeth and get high, and we know that that's not the case. So we need to talk about all the things.
Well, I think where we are right now with anti-caries therapeutics is people are wanting to say, well, is there evidence? Is there evidence? And I said this loud and clear from the podium at Hinman. I don't care anymore. I really don't care if there's evidence, because we all know that dry brushing works. So if you just agitate the biofilm off your teeth a little bit, if you're high risk because you're not brushing your teeth and you start agitating the biofilm, disturbing it more, you're going to decrease your caries risk. If you put anything on your toothbrush that makes you want to do that more frequently, you're going to decrease your caries risk even more. So just giving the patient a product they want to use, and so help me, if it's a patient who says, I brush my teeth with CBD, and that's what's, and I mean, we look in patients' mouths. I looked in a patient's mouth yesterday, as you know, Pam, who hasn't been to the dentist in more than 10 years. And I saw a restoration that I placed on the high risk quadrant. Because, remember, we geeked out in the fact that one quadrant mouth was very high caries risk. She's got this hemifacial spasm that kind of seems to pull everything to that one quadrant. And yet the facial surface of that molar that I restored with a material that I only used just maybe a few times just as a trial to see, I wonder how well this works. And it's not glass ionomer. That darn thing looked fantastic in her molar. However, I will just point out it was on the facial surface of her maxillary first molar, and that's a very low risk area. So that probably was not the best tooth to put a material in to see how long it would last. But 10 years without any recare, and that thing's still doing really well. Anyway, we were talking about CBD. How did I get on that topic about that lady in her upper left quadrant?
Anything that makes people want to brush more at home is good.
Oh, yeah.
Wow, David, that's so good. You were listening. I think I zoned out and started thinking about other
I'm
stuff.
dialed in, man. This is good stuff.
Pam, you were going to that place where you're like, I want to help my colleague with this patient. That's right. What did we find out about that patient?
No, I was thinking about number 6 distal. I was thinking about the
You
other.
did find number 6 distal on there too. Yeah. We have to look at those radiographs with AI. You
Yeah,
remember? Yeah, we got it. Okay. Anyway,
Monday, I promise.
so Dr. David Rice, we were
Yes.
talking about CBD, and I don't think people realize that there is evidence for CBD in the perio literature and in the caries literature. So we know that CBD has anti-inflammatory properties, especially when it comes to reducing periodontal inflammation. I mean, it affects interleukin 1 and interleukin 6 and tumor necrosis factor alpha. But what I think is so fascinating about when you start looking at CBD and realizing that it's these compounds, it's these natural cannabinoids that our body makes that have these anti-inflammatory properties, that if we studied them more, we would understand what is the exact mechanism for action for CBD and these non-endogenous cannabinoids acting on the body. Because I think people go, oh, that's all granola out there, whoo, fluffy stuff. But the reality is there's really cool data right now on the fact that in our saliva during sex, we produce opioids. We produce a compound called opioorphin in our saliva. And I'm just thinking, in that moment when you're passionately involved with someone and you want to kiss them, it's because of what's actually being released in our saliva. We're actually giving each other drugs in our saliva. And people are just now beginning to understand that. And the topical effect of these drugs on other humans through our saliva, and the fact that this is it's a communication mechanism. And knowing that these topical cannabinoids are in our own mouths because our body makes them, it only makes more sense to actually start capitalizing on them when realizing, well, yeah, then we should be putting them in toothpaste too. Why are we putting electronegative anions in toothpaste instead of what we know the body actually puts in there as an anti-inflammatory compound anyway? And yet we haven't studied it because we associate it too much with the THC high. And so everyone assumes if you even are thinking CBD toothpaste, you must be thinking, well, I want to get my patient high with toothpaste. And that's not the case at all with these toothpastes. That actually those patients who gravitate towards cannabis products anyway, when they find out my healthcare professional actually says this is the one toothpaste or one of the ones they recommend and has CBD in it, well, heck, then I want to use that. Why would we not capitalize on the fact that patients want these compounds? So that's where I am these days.
So are these toothpastes available? Where are these magical things?
Yes, Pam, they're available. I thought, didn't you see it in the office? I brought it in.
No, I've tried it. I just tried to throw you a little bone here.
Oh.
Heat it up.
Okay. Well, yeah, birch tree hemp toothpaste is the only one that you and I know has the backing of people who are in the oral healthcare space who know what they're doing to make toothpaste. This isn't some mom and pop company that's concocting something at their dining room table and selling it. These are powers that be within the oral healthcare industry, not so quietly, but launching now a CBD toothpaste. And I think it's cool. So Pam, if you can't find it, I might have left it hidden behind some stuff in the supply room.
No, it's okay. I found it and it's in my house. And
Oh,
so,
good on.
yes, no,
It's
and
inside
I've
your toothbrush.
it's been on my toothbrush. No, I've actually tried it. Sometimes I get a little worried when you're going to try something new and there's, something like CBD in it. You're like, could this thing actually taste like toothpaste? Is it going to be
Exactly.
weird and whatever? Actually, and I'm like a little, like, I had COVID, so like my taste is still a little weird. Like, so I either like it or I don't. I actually really like it. And I feel like it's, like my teeth feel great. It tastes good. Like from like the end user standpoint, I really enjoyed it. So I think, especially with the fact that there are actual scientific benefits to implementing CBD into your recommendations, I say, why not? I think we should go for it.
Now, let me just caveat. Is there evidence? No. Is there research? Yes. And so let's not get worked up on the fact that there's no evidence. There is research, and we will get more evidence, which is the outcomes. And certainly in the evidence-based triad, you have what does the patient need and want? Well, if they want cannabis products, CBD toothpaste checks that box. If the clinician says this patient, is I'm not treating some weird form of caries or I'm not using this stuff for some therapeutic benefit that I'm claiming it works. This is a patient who's maintaining their health with a product that they want to use. And the research actually shows, yeah, I mean, it does improve inflammatory markers topically. We see that in the literature. So you've got the triad of the evidence-based pyramid right there. So, I mean, one of the things that's really nice about these days is people are not so, I think, reticent to try things other than fluoride, especially in where we are right now with the F word. Starts with F and ends with oride.
So no, it's certainly a great thing to keep in your back pocket. And it's, I think also it's important that we understand what products are out there, because when patients ask you, I feel it doesn't look so good when you're like, I don't know, I'll have to look it up, or never heard of it, can't possibly be good. So I think
And
that having these conversations is important.
I didn't mean to cut you off, Dr.
That's
Pam,
okay.
but I was thinking, and understanding the psychology of how we change patients' behavior. If a patient thinks something works and you shut it down, you've just lost that patient right there. So you may not like what the patient is doing, but the moment you disagree with their reality, you've lost any any ability to change the patient's behavior, because you're not going to convince someone if they think that you disagree on a fundamental level. So you're much better off just to agree with them in the moment and try to figure out, okay, so what do I need to say to change their behavior, as opposed to just shooting them down and saying, oh, there's that stuff can't work, because that's more detrimental to that patient in the long term. So
True story. All right, what else we got?
well, have you checked your mouth with Bristol Oral Health, Dr. David Rice? Have you sent off a sample of your saliva and waited 30 days for them to tell you what is growing in your mouth and what you can do about it? And what
Not
prebiotics
yet.
you need, probiotics? You need to.
All right. How do I do that?
Well, go to, I don't know what their website is. I'm sure it's bristle.com probably, or bristoloralhealth.com.
We should
But
do it and talk about our bacterias.
you totally should. It's this thing, and it's
Okay.
like this box that you get. Remember Bridesmaids, the movie, when she opened up her invitation, the butterfly stood? That's like this.
Yes.
Oh. And you put this next to your bed or in your bathroom counter. So the first thing when you get up in the morning, you just spit into this little, well, that has a little funnel. You spit it into this tube, throw it in the mail, and it takes them 30 days. But 30 days later, you're going to get an amazingly detailed report on your mouth. And it costs you 150 bucks. And you can share it with your dentist. So my dentist is going to be getting an email link to look at my Bristol Oral Health data, because, and I must admit, I sent this to my dentist in Idaho first. I sent my data to her first. Pam, I'm sorry, but she needed this for some nursing home patients, because
I almost used the other F word.
We lost all
Coughing?
the love fest that we began
It's
with.
not, it wasn't, Pam, it had nothing, it was nothing personal. It's simply because there's a dentist in Idaho who's been sequencing bacteria from nursing home patients to understand what's going on in their own microbiome as they begin to transition. And it's just fascinating. And she needed kind of something like a baseline to look at. And so I sent her my data first, and I need to put on Bristle that you're my dentist. And
That's okay. I'll use a different F word. You're forgiven.
Wow.
Oh, that's a good effort. That's a good
Thanks.
effort.
You're quick with the F words.
Oh, I'm good with those. F words are my specialty.
That should be another episode.
So speaking of F words, I don't have any more F words, but I have something that's not an F word for remineralizing teeth. Have you heard? Now you, Pam, you have heard of Crystal Care and
Yes.
Lumicare, right? And the caries detection technology. But have you tried the new strips for remineralization that they have?
This is from Green Mark Bio, the crystal
Yeah.
care strips. I
The
have
crystal care
not.
strips?
I know of them, but I
So,
haven't tried them.
so you, as my dentist, should probably be aware that your patient has been using the crystal care strips on 19.
Oh, okay.
Yeah. So Dr. David Rice, I don't know, can we violate HIPAA? It's not a HIPAA violation when the patient shares the information with everyone. Most people are familiar with my lower left, number 19,
Yes.
lower
Yep.
left, first permanent molar. Of course it's permanent. Why would my primary molar still be in there? That wouldn't be weird, but everybody knows Dr. Brian Novy doesn't have a retained primary molar. They know that number 19 has been brutally destroyed through aggressive dentistry through the years. And the result of a child taking Explorer and poking from tooth to tooth to tooth.
Started it all.
Dr. Pamela Maragliano-Muniz did a direct injection molded glass ionomer crown on the tooth, which she shows in her lectures, and I showed in my lectures for years. And it did eventually fail, and it broke off, and we made a new crown for it. And so I haven't gone into the office to get it placed. And Pam, do you want to say how long it's been? It's been way too long.
No, I don't. I don't want people to think that the timeliness of care is not important.
It's everybody knows in a busy practice when the dentists take care of themselves least, right?
I know. We're like the shoemaker's crew.
We've had my
Yeah.
crown hanging out in the lab for too long. And I tried putting it in my mouth, it fit. I'm like, okay, we'll cement that someday. And I put it back in the lab. And I should just fill the darn thing with cement and put it on my tooth. But in the meantime, because there's no temporary on there, I eat a lot of pineapple. And I I love sour candy, as you know. And so it started to get a little sensitive. And so I used one of these crystal care strips, and I'll be darned, it worked. It actually, the thing like went right down my tooth and just released calcium phosphate the way, because there's, Dr. Rice, just to, so you're aware, are you aware of what we're talking about? These are nanoparticles of calcium phosphate bonded to starch that then in water, that starch hydrolyzes and releases calcium phosphate right where you want it. And so it can actually penetrate through the caries lesion, basically feeding the bacteria that are causing caries, and they break down and hydrolyze that starch molecule. And then, but you think, well, why would you want to do that? Well, when you break that down and you flood that area with remineralization potential and shift the pH, you've actually just capitalized on thermodynamics and shifting the acidic environment to basic and capitalizing on crystallization at that moment in time. So it's really kind of cool. But yeah, crystal care strips. So how about
Love that. Okay.
Yeah. Yeah.
All right. You're not done with your
No.
list. So
What
keep
are we gonna
going.
talk
I know
about?
this is like a marathon. You have pop rocks.
Oh, the breath rocks.
Breath rocks.
David Rice, you used to work at the factory that made Pop Rocks, did you not?
I did. It was a wonderful summer job. A little place called Rich Products. They made pop rocks and like pudding and creamers and things.
Sweet.
Well,
Different pop
I
rocks,
used
I'm
I
imagining.
used to steal dental insurance from the dentist. Did you steal Pop Rocks from your employer?
It's possible that a few jumped into my pockets.
Falling off the truck.
Maybe you didn't steal them, but you helped them determine if the flavors were consistent while
It's
you were on the
testing
clock.
efficacy of flavor.
Yes. Well, I don't know if Pop Rocks are now off patent or what the deal is, but did you know that there is anti-caries Pop Rocks candy now? This
I
is
had
Pop
no
Rock
idea.
to reverse caries. Are you ready?
But this is
Blueberry
called
Pop
breath rocks, right? Not
Oh,
pop
breath
rocks.
rocks. It's actually
Breath
not
rock.
anti-caries. It's actually breath freshening Pop Rocks. But these are blueberry.
Okay.
Ooh.
That's a lot of dosing right there. I'm just saying.
Yeah, actually, yeah, it's probably too much. But and I have a zinc in them. Oh, can you hear it?
I heard one.
I heard a pop.
I'm salivating like crazy. So if for those of you, can you hear them? You must be able to hear them because I can hear them. They're resonating in my. Anyway, for those of you who are back on the dating scene and you need fresh breath, Pop Rocks, blueberry, breath rocks, anti-caries candy with zinc is and they come in mint, cinnamon, and blueberry. I really, really like blueberry. Fantastic. Well,
Oh, I can't wait to try them.
you know, I
Yeah.
remember years ago, someone said to me, Brian, you got to stop talking about caries because nobody wants to listen to this stuff. You need to learn to talk about composite. Can I just say how glad I am that I didn't learn to talk about composite and I learned to talk about caries? Because don't you agree this was a much more entertaining conversation than talking about the C-factor shrinkage stress as intermolecular bonds are replaced with shorter covalent bonds? Seriously? But I mean, I would much rather talk about Pop Rocks.
No, I think this is super fun. Now, can you also talk about, I know I'm putting you on the spot here, but I believe it's a lozenge that has different levels of the ability to make you salivate. You know what I'm talking about? I have a picture of you holding it in the office.
Uh-oh.
Oh my gosh.
Oh, you're talking about
Yes.
Flint's Mints.
Yes.
Flint's Mints. Yes, Flint's Mints. I have them right here.
Ooh, look at that. This is
Where
preparation, friends.
Flint's Mints. So there's this candy maker, and I've recently, I don't know, the candy companies are coming out of the woodwork to come talk to me now, but these are called Flint's Mints. They have spilanthes in them, which is actually otherwise known as toothache plant. And it's kind of spicy, like almost like capsaicin, but not, has a numbing effect. And these mints make you salivate like crazy. They come in different, what they call F strengths. So like the grape ones are the lowest strength, it's F125. The cinnamon ones and the mint ones, or I think they have like a pine, frosty pine, I think is the flavor. It's like Altoids almost. But these make you salivate like crazy. The problem with these things is there's something about them that can be somewhat irritating to the mouth after if you use too much of them. And they are candy. Well, they're actually not candy. They're sugar-free candy. Well, they're not candy. They're sugar-free mints that are supposed to capitalize on the stimulatory effect of your mouth. So a lot of people have oral fixations and can distract themselves by sticking things in their mouth. Now the idea is by using these candies that stimulate our mouth in new ways, we can get people to avoid more deleterious behaviors like smoking and stuff like that. So rather than using Nicorette lozenges, using little spicy mints and things that give our mouths a tingle. Of course, I don't know how far down this road you want to go, but can we talk about the tablets that you can put in your mouth that make anything you put in your mouth taste like candy?
What?
No matter
Anything?
what
That
you
feels
put
like
in
a
your
great way to
mouth,
wrap it up.
no matter what you put in your mouth, it tastes like candy. And there is an entire industry now, which is doing very, very well. Number one, with self-flavoring agents and taste-changing tablets. So that anything you put in your mouth tastes like candy. Especially the more weird it tastes, the more it tastes like candy.
Interesting.
Yeah, more to come.
Pam?
There doesn't need to be more to come on that. You could ask me for more information right now if you wanted. I might be just a little too sly with my answers. Am I being too sly with my answers?
No, but this is Dentistry Unmasked. You can unmask the truth.
Well, so there are, I mean, here's what's, I mean, did you ever think when you were in dental school or before you ever went to dental school, the fact that you would be the healthcare professional that would be discussing oral sex the most with patients? I mean, maybe you don't discuss it as much as I do.
I think you discuss it more than I do. You can be the oral sexpert at Salem Dental Arts.
Okay. Well, I tend to be wherever I go. So there are, that sounds weird to say. That sounds really weird to say. But in all seriousness, there's a company that is making self-flavoring agents called 9 Pines. It's a little shot of the concentrate of 9 pineapples with other flavoring agents to sweeten yourself. And that same company sells them in co-packaged with tablets that once you suck on this tablet for just a few seconds, I would not recommend that anyone suck on the full tablet for the full amount of time because for about an hour after you suck on that tablet, you could literally take a bite of an onion and it'll taste like you just bit into the most wonderful, luscious cherry. And it'll be like sweetness dripping down your face and it's really onion juice. These things are amazing. So no matter what you put in your mouth, it just tastes like deliciousness. And it's funny. It's not funny. It just amazes me that we in dentistry, these kind of areas of oral health care are very niche, but our patients actually find them and have experience with these things. And so when they come in with their tongues denuded and they're like, I have these 2 spots on my tongue that are raw. And you're like, well, you have burning mouth syndrome. They might not have burning mouth syndrome. Maybe they found Flint's mints and they were using F-string 275 and sucking these things down like crazy. And that's what caused the problem. And you start talking about burning mouth syndrome, want to give them some compounded formula to stop their burning mouth syndrome. And it turns out, no, we really just need to be more in tune with what our patients are actually finding online nowadays and putting in their mouths because there are agents that actually change your taste. Now, also imagine the creative oral healthcare professional who figures out how to get kids to eat vegetables by changing their taste perception and getting people to say, I hate the way that candy tastes. It tastes disgusting. I would much rather eat a banana or I'd much rather eat fresh fruit. So I'm excited for what's happening in cariology and especially in the understanding of saliva and taste perception and where we're going to be taking all of oral healthcare with a better understanding of saliva.
Wow. I see so many different applications. Gosh, if I was going on the Amazing Race or Fear Factor, I'd be calling you first and being like, what do I need to bring with me? But
Taste
sadly,
changing tablets. So no matter what you put in your mouth, tastes like candy.
yeah, no, there's things that I can't even watch on TV
I
that I
know.
can't imagine doing in real
I
life.
know.
So there you go. All right, there's an application that's G-rated. There we go. Okay, Brian, sadly, we're out of time. And so clearly we're not
Oh
done with this
man.
conversation. I know, but I think that we should find out where you're lecturing soon, where can people find you, follow you, etc. And that's basically all she wrote.
Well, I'm kind of hard to find these days because unless you're looking for a dentist in Salem, Massachusetts, um, no, you can go to my website, www.holymolar.com. That's spelled WHOLLYMOLAR.com. Holymolar.com. Go to my website, find the P's. If you find the P's, I will tell you where I'm speaking. But I don't put my whole schedule out for everyone to see. But if you become a Novy groupie on my website, I will give you my speaking schedule and let you know where I'm going to be in your area.
I love that so much. This has been awesome. I know we said it last time we need to bring you back, but can we bring you back sooner for God's sakes?
I just gave you everything that I have up my sleeve. I've got to go back to the drawing board and come up with more stuff.
All right.
Well, we can talk about your new scrubs next time.
There you go.
The new scrubs. I become a scrub model. That's right. Rise scrubs, everyone. Rise. Arise scrubs.
Pam, what do you know?
I don't know anything. All right, everybody. Thank you for
She
joining
did it.
us.
She's the one who made the connection for me.
I did. I turned Brian into a scrub model. Oh my goodness.
I feel so super sexy in Rise scrubs. And may I say, the improved pocket. I love the fact that my cell phone doesn't slip out. There's no way for your cell phone to slip out of your pocket with those scrubs. And of course, the improved crotch gusset it makes it worthwhile.
Gusset is everything.
Dr. David Rice, are you aware of the improved crotch gusset in Rise scrubs?
You know, I'm not, but it sounds like I'm going to become aware of those as well as many of the products we've talked about today. So I've got some homework to do. It was great hanging out with you guys.
Likewise.
All right. We will see you soon. And everybody, thank you for joining us. And we will see you on Dentistry Unmasked next week. See you later.
Cheers, guys.
Bye.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.